That's a great day. When it comes to your health, you can avoid a mouthful of problems if you make your gums a top priority. And here are the top things your dentist wants you to know about gum disease. Welcome back, the Texas Tooth Lady, family and cosmetic dentist, Dr. Terry Alani with her Tooth Academy. All right. Dr. Alani, the problems with our mouth, we out of sight, out of mind, unless we have pain. That's what usually drives us to the dentist. But the bad stuff is working and churning all along. That's why we need to get in to stop that. In fact, half of all Americans over the age of 30 have some form of gum disease.
That's right. And what gum disease, you have to realize, it's silent inflammation. And not everybody has it. Everyone has bacteria in their mouth, but not everybody gets gum disease. There's a genetic component. It's a low-grade chronic bacterial infection, and we call it periodontal disease. And it can actually cause tooth loss. I mean, you've got to really, there's risk factors that are involved too, which we'll go into in a minute.
Yeah.
And bleeding. Yeah. Bleeding is a strong indicator. Healthy gums don't bleed.
When you brush your teeth.
I have patients come in and go, oh, doctor, you know, my gums are just bleeding because I'm stressed out. Unless you're on a blood thinner or you're taking aspirin, healthy gums do not bleed. Okay, what are the causes of gum disease? Okay, basically what happens is, you know, we talk about flossing. Why do we talk about flossing? Because when you eat, you get food stuck in between your teeth. And if you don't remove it, that bacteria just feeds on that, and the bacteria can go deeper. It's very difficult to clean out. Because
think about it. I think you made this very visual for me. Like when you eat, would you not take a shower and not clean between your toes? But really, if you're eating and you have meat, if you have meat stuck between your teeth, that's rotting meat stuck between your teeth.
No, it is, and it's hard to clean out. That's why you come see us or you floss. Right. And what happens is that bacteria just seeps down in there, and then it can actually cause tooth loss. It causes inflammation. It's very difficult to remove.
All right. Finding the gum disease. This is why it's important to be at your dentist's office.
Right, exactly. So here's what we do. First of all, we take digital x-rays. On this x-ray, you can see this is severe bone loss here, okay? It's a little bit grayer than it is with this. This is healthy bone. It's very dense. Okay. So we also do clinical examination. On the clinical examination, we look and we see, are the teeth healthy? Is there a lot of tartar? Are there bleeding gums? Are there any mobile teeth? So we check that on a clinical exam. Then we also use a periodontal, I call it a ruler, because anytime you say the word probe, people get nervous. So we use a periodontal ruler that actually checks the pocket between the gum and the tooth. And there's certain measurements that we go by, and then of course there's the health history that we ask, because there are risk factors, because as I said, not everybody gets periodontal disease, but everybody has bacteria in their mouth.
Yeah, all right, and the effect on the body is not just contained to the mouth.
No, it's not. You just remember, the same bacteria that causes inflammation in your mouth is the same bacteria that causes inflammation in the rest of your body. So here's what happens. You can get an increased risk of heart disease. You can get an increased risk of pulmonary infections and recurrence of gastric ulcers. If you're pregnant, it's really important to get your teeth cleaned because it can cause premature babies and low birth weights. And that's really important. And also, if you have diabetes, it can cause your blood sugar to go out of whack. So,
in fact, a lot of times you can help steer somebody in another direction to another specialist, because you can detect other issues going on in the body just through that mouth.
Exactly. We are now the mirrors to the rest of the body. People used to just look at us as, you know, the drill sergeants. We're no longer the drill sergeants. We actually can take care and diagnose other areas that might be problematic in the rest of your body.
Yeah, speaking of problematic, tobacco and gum disease, that's not a good combination.
No. Nicotine makes it very easy for bacteria to cause the inflammation, and there's also a component of secondhand smoke. If you're in a household and you smoke, you want to have anybody in your household get checked for gum disease because they're at a higher risk. And the other thing is, people go, well, why do you have us come in every 3 months instead of every 6 months to get your teeth cleaned? Because it takes 2 to 3 months after you've had your cleaning for the bacteria to regrow and cause problems again with gum disease. That's why we put you on a more frequent cleaning.
Yeah, you will be ahead of the game.
Exactly.
All right, obesity and gum disease has a connection.
People that are obese have a higher risk factor for gum disease because they have more inflammatory moderators in their system. So it's real important to keep your weight ideal. But if you are overweight, you want to make sure you go in, you see the dentist regularly, because we can correct things way before they get out of hand. Again, more frequent cleanings.
Right, and of course, type 2 diabetes and then gum disease kind of go hand in hand as
Exactly.
well. All right, and then preventive tips and treatment. So obviously, regular visits is key.
Regular visits is huge. Brushing and flossing. I heard the audience person ask, how many of you brush and floss?
Yeah,
Flossing
yeah, let's ask them. Wait, okay, how many of you, okay, because you know when you go to your dentist office, the dentist says, and do you floss?
But the
okay,
truth.
wait, raise your hand. How many of you really floss?
The truth.
Okay, now how many of you really floss?
I tell you another tip that's really good instead of flossing, because some people just don't like wrapping those around. You get those little rubber, like Christmas tree brushes. That's what I use. And you go in and it stimulates your gums and it's great.
Yeah.
Another thing is Atrodox. Atrodox is a gel that we can place between the gum and the tooth. It's an enzyme suppressant. Basically, this is not a needle, guys. This is just a syringe that places the Atrodox. It's an enzyme suppressant. It suppresses the enzyme that causes bone loss, and it's a form of tetracycline. Okay. So if you're allergic to tetracycline, you don't want to use this, but this is really effective. Then we have Periostat. Periostat is a pill that we can dispense to patients. You take it twice a day, and that actually keeps everything at bay.
All right, you have deep cleaning, customized daily program.
Yes, and then chlorhexidine, which is an antibacterial rinse that you get from, it's a prescription from your dentist, but you only want to use it for about maybe 10 to 20 days after your first cleaning.
So the problem can be taken care
of.
Hey, Dr. Lonnie has a special offer for Great Day viewers. When you come in as a new patient and get a full mouth set of x-rays, you will receive a free exam and oral cancer Velscope exam as well. For more information or to schedule an appointment, you can call 713-621-5141, 713-621-5141, or visit her online at Texastoothlady.com and like her on Facebook at facebook.com/TerryAlaniDDS.